My name is Charles Kevin Bryant, and I am a nursing director at Eastern State Hospital. I was in school to get my DMP, and so we needed a project. Needed to do some sort of study to work on, and so I needed an idea. And at the time, I was actually a patient care manager on an all-male unit. The unit didn't go very long in between seclusions or restraints. In fact, they never had made it more than a month or two without having a mechanical restraint. And so when I was down there, one of the things that I tried my best to do was to educate the staff. We did a bunch of different interventions. I was one of the first nurse managers to have monitors in our office where we could see the camera footage. And so I would use that to provide real-time feedback. And eventually we went 5 years mechanical restraint free on that unit. And so when I'm in school and I get this project, I was like, okay, well, I spent my entire professional nursing career in mental health. And one of the things they're always talking about is how can we continue to reduce our seclusion restraint? And so I wanted to do something that I thought would help with that, but I didn't want it to be the sole focus. So yes, I wanted to see if I could, do an intervention that we would see some reduction in seclusion restraint, but I also wanted it to be deeper than that. So I started looking at the research that was out there. And I came across an article by Linda Janelli and her colleagues, and I was reading about this. And as I kind of dived more into it, I just found there was, a lot more gaps out there about this. Either people looked at, assessing baseline knowledge, practice, and attitudes, a combination or all three, but they would do it. I only saw it either for nurses or providers. I didn't see it that covered both in the same. I also didn't see, there was very little research that existed for someone that they assessed baseline knowledge, practice, and attitudes, provided an intervention, and then reassessed to see improvement. I wanted to collect the baseline data on knowledge, practice, and attitudes, provide this education, and then see if there were improvements in those three domains overall. And I hoped that if there were improvements, that we would see some improvements in our seclusion restraint data, which we did. So that's kind of how all of this came about for me. Education would be the biggest one. As I said, I asked for camera monitors in my office, and I use that to provide real-time feedback to the nursing staff down there. If I saw something, if they put someone in seclusion or restraint, and I noticed that the patient had been calm for several minutes, but they left them in there for a longer time, I would bring them back to my office. I would show that to them on camera and provide my feedback. I would also talk to them about alternatives, whether that was timeout, some sort of sensory item. And so there was lots of education that went into that. And I'll also say, just the staff themselves, we were able to change a culture, the willingness of them to be open-minded and to look at it a different way. I would highlight the education, which I then think that the study that I did and wrote about, we kind of described how this education helped for those domains and showed some improvement for seclusion and restraint. First, I think what I did and what we wrote about laid some good groundwork that could be expanded upon. There were limited participants in this. I would like to see it on a larger scale to see if the results could be recreated. But then also it would be interesting to take that and compare, what one of the demographics that I collected on there had to do with years of service. So when you looked at those three domains, knowledge, practices, and attitudes, what would someone with less than 3 years of service compared to somebody who had 15 years experience? Like how would those scores in those domains come out? This is the second project like this I'd ever done within this hospital. So my experience with it compared to this was a lot different. I had someone kind of on that first time going through guiding me the entire way. And in this one, I kind of got to create it how I wanted to do it. Of course, I had people helping me from my advisor and professor and, my supervisor who, would give me some ideas. But I think just going through this experience with all of this has been it's been exciting and unique. This is my first time ever getting something published, and going through that process was different. Really enjoyed having this opportunity and being able to do this, and I'm very excited about it. And all my colleagues and coworkers and supervisor and my parents, they're all really excited for me to be able to share this work that I was able to do here at the hospital.